Cancer screening helps find early signs of cancer, often before you notice any symptoms. It's completely normal to feel unsure or worried about screening, but going when you're invited is important. Finding changes early gives you the best chance of successful treatment. Not all cancers have reliable screening tests, but the NHS currently offers screening for cervical, bowel, breast and lung cancer. If you're not sure whether you are eligible for any type of cancer screening tests, please visit the Stand Up to Cancer Screening Checker website provided by Cancer Research UK, which can provide you with more information.
Cervical cancer screening is offered to women and people with a cervix aged 25 to 64. You'll be invited every 5 years. The test is done at your GP surgery. A nurse will gently insert a speculum and take a sample of cells from the cervix using a special brush. This is then sent to the lab. This is the cervical cancer smear test.
You can book by calling the surgery or through a booking link if your test is overdue. Results are sent by post and also appear in the NHS app. If any changes are found, you may be referred to the hospital for a colposcopy, which is a closer look at the cervix using a special camera.
Bowel cancer screening is offered to everyone aged 60 to 74. Every 2 years you'll receive a home testing kit called a FIT test. It checks a small sample of poo for traces of blood. This non-visible blood can sometimes be an early sign of bowel cancer or other bowel conditions. Results are sent by post and the hospital will arrange any follow-up if needed.
Breast cancer screening is offered to women aged 50 to 71. Every 3 years, you'll be invited for a mammogram at a hospital screening centre. A mammogram is a breast X-ray that can detect cancer at an early stage. The hospital will contact you with your results.
Lung cancer screening is available for adults aged 55 to 74 with a history of smoking. You will be invited by your local NHS screening service, not your GP surgery, for a one-off lung check. The first stage is a lung health check, which is a 15-minute telephone consultation which covers smoking history, lifestyle and breathing symptoms. If deemed high risk, you'll be offered a low-dose CT scan to take detailed images of your lungs. If you have not received or have missed your invitation for lung screening, please contact your NHS lung screening programme, which can be found via the NHS website. The lung screening team will contact you directly with the results. Going for cancer screening when you're invited is a simple way to protect your health, and it could save your life.